Chapter 37, Nursing Care of the Child with an Infectious or Communicable Disorder. We're going to talk about some differences in children and adults in the infectious process. We're going to talk about some interventions related to lab tests and diagnostic tests. We're going to talk about assessments related to some medications and treatments. We're going to distinguish some various infectious illnesses in kids. We're going to talk about a plan of care and the teaching plan. So some differences in the pediatric and adult anatomy and physiology is that they have immature responses of the immune system, so they're more susceptible to infection, a decreased inflammatory response. The cellular immunity is generally functional at birth, and then humoral is when they incur some type of immunity diseases. One of the biggest things is that the infant has a limited exposure, has had limited exposure to diseases, and they are starting to lose that passive immunity from the maternal antibodies, so the risk of infection is higher. And then that disease protection from immunization is incomplete. So when you see these brand new babies and out in the public, it really worries me because they don't have a lot of immunity and they can get very sick, and they have very short, narrow airways, and so respiratory infection could be fatal. So fever, we talked a little bit about fever. We see this a lot in kids. I won't go into the anatomy and physiology of it, but when you think about it, a fever triggers that cold response, so that shivering, vasoconstriction, decrease in peripheral perfusion, which means that you have sometimes a hard time getting an IV in. So when they are constricted, it's already cold in the ER, and now they have a fever, and so making sure that we're not piling blankets on them, but treating the fever instead. So for communicable diseases, we have to be aware of our standard contact, droplet, and airborne precautions. So make sure that you're following your policies of your institution as far as the right type of precautions for the different areas. So treatments, so what do we do for infectious disorders? Hydration, fever reduction, and then antibiotics or antivirals, antipyretics, antipyretics, depending on what the disease process is. We'll do blood counts, and we're looking for a high white blood count, usually a sign of infection. A C-reactive protein. A C-reactive protein in people should be normal, but if it's elevated, there's some kind of infection going on. Blood cultures, so we'll do blood cultures looking for septicemia. Urine culture, looking for a urinary tract infection. Cerebral spinal fluid, so if there's white blood cells, protein, low glucose, it's some type of infectious process going on. We may do a stool sample. The way to get a stool sample of a diaper is to scrape the poop with a tongue depressor, and then put it in a medicine or in a urine container, some kind of cup. If a kid comes in and they have a shunt, or they have an infusoport or portacath, and they have a fever, we may consider that that's a source of infection, so they'll culture those. And then do an x-ray to see if there's signs of pneumonia. This is just the procedure for lumbar puncture. So sepsis, we're worried about bacterial infections in children, especially those under 2 to 3 months old. It can be deadly to them. So if a child comes in, most institutions with a fever, and they're under 2 or 3 months old, depending on the policies of the institution, and if they have a fever, so a reported fever was the parent saying they had a fever at home, or they have a fever when they come, and the degree of fever really depends on your policy. So sometimes it's over 99, sometimes it's over 100. They will have what's called a septic workup, and so we're going to do blood cultures, we're going to do urine, we're going to do labs, and we're going to do a lumbar puncture. And then with sepsis, there is a time to antibiotics if anything comes back positive. So you want to make sure you're in that window. If a child comes in, an infant, and they have a fever and the doctor's orders a septic workup, that's kind of like you stop what you're doing and going and do that workup. You might need help getting all that, but it's time is of the essence, because if they are septic, early intervention is going to be good. This just kind of goes into the SIRS and then sepsis, severe sepsis, and shock. You never want to get to the septic shock. Sometimes it's a community-acquired methicillin-resistant staph. They can have scarlet fever, diphtheria, pertussis, tetanus. Haven't seen any tetanus in many years, but I guess it could be, they could have it. When we think about some illnesses, we see some viral illnesses, so mumps. So mumps is a swollen parotid gland. We think about cat scratch fever and rabies. Kids get bit by dogs, and it's important to identify the dog. So sometimes families, parents don't want to let you know which dog it was, because if it's their own dog and they don't have their shots, that dog will have to be quarantined. If it is a stray dog, then that kid is probably going to get a series of rabies injections. So we have to report dog bites to the animal control department. Basically, it's I believe it's an online form now that you send in. What they want to know is the address of where that dog is, if it's identifiable, so that they can quarantine that dog or find out if they've had their shots. Otherwise, the kid is going to get a series of rabies injections, which is not fun. Some of the vector-borne, so we talk about Lyme's disease. Lyme's disease is like a bullseye. Rocky Mountain spotted fever. Haven't seen really that in years. But mosquitoes causing that Lyme disease. We see that in heavily wooded areas. Parasites, those are always fun. Scabies, so scabies, they'll have like in the webs of their hands, you'll see a rash, sometimes a dried rash. Head lice are fun too. So you have the nits, which are the eggs, and then they will hatch into the head louse, so lice to louse. Sometimes kids pass this from kid to kid. It doesn't mean that you are not a clean person. It means that kids are sharing way too much. Headbands, barrettes, combs, hats, things like that. Getting rid of lice can be very frustrating sometimes. So it's a process of washing everything and using the shampoo, getting the lice out, and then sometimes it comes back, so it's frustrating. Pinworms, roundworms, hookworms, haven't really seen a lot of those, but your book mentions those. Sexually transmitted infections. That should say, sexually transmitted. So we used to call them sexually transmitted diseases. Now we're calling it sexually transmitted infections. So oral, vaginal, through intercourse. These are reportable to the public health department. So herpes, gonorrhea, HPV, hepatitis, chlamydia, syphilis, those are all reportable diseases. Doctors will do cultures, and then after 3 days, the nurse gets the fun job of calling people and telling them they have an STD or an STI. Part of that conversation is letting them know that any partner or partners have to be tested too. Some people want to know how they got it. Some people will say, well, I was only with my husband. I'm like, well, I want to talk to him. So we do see it. If it is a child with an STI, typically we let the parent know also. But we see a lot of these. And then managing it, you want to assess temperatures. You want to make sure that you're giving antipyretics. We typically, if the child has a fever that they just can't break, we'll give Tylenol every 6 hours, ibuprofen every 4 hours, around the clock, both of them. And so there are times you're going to give both those medications, and that's okay. Parents get a little freaked out about it, but it is okay. You want to use the same site, the same way to measure the temperature. and then making sure that you are medicating the child, and then assess their fluid intake, oral intake, and IV fluids if needed. Okay.